Bedwetting after the age of 5 is always due to laziness or bad habits. As a pediatric urologist, what is your take?
Not necessarily.
So frequent urinary tract infections among children are very normal. You need not worry about it. Do you agree with this?
Not at all. Frequent urinary tract infections.
Holding urine for long hours. When it comes to children, when it comes to youngsters, it's very common, it's harmless. It can be allowed. What is your take on it?
I see this as a tragedy in practice every day.
Hello and welcome to the News Minute. This is Real Talk powered by Apollo Hospitals, Chennai. And joining me today is Dr. Sripathi, who is a pediatric urologist with the Apollo Hospitals, Chennai. And today I'm going to talk to him about a subject that has left many parents concerned and at sometimes anxious. Doctor, thank you so much for talking to us. Many parents assume that their children cannot have urinary issues. How do you respond to this?
It's funny, in spite of the fact that a lot of people think like that, more than 40% of the surgical problems that happen in children belong to the genital-urinary system. A lot of the problems are surgically correctable. And if you correct them, then they all have a normal lifespan.
So what are the most common pediatric urology conditions that you encounter on a daily basis when you treat patients?
Commonest condition that we see are children who develop urinary infections. Urinary infection basically is a pointer to something abnormal within the urinary tract, either in terms of a blockage to urine drainage or to an abnormal passage of urine, like urine going back from the bladder up into the kidneys, which is called vesicoureteric reflux. Children in school who don't have free access to toilets. Children often come to us with presentation of holding urine throughout the day, which in turn has disastrous effects on the urinary tract.
What are the signs that parents should look out for?
What we tell them to look out for is if the child has a fever without a cough and a cold, or if the child complains of a burning sensation or pain while passing urine, if the urine changes in color. Under the age of 1 year, urinary tract infections are very important. If they have a fever without cause, a very high fever without cause, the first thing that we think of is urinary infection. Don't reach out for an antibiotic that is at home and give it to the child. Please make sure that you meet your doctor. If a child consistently complains of difficulty in passing urine, this is something that we have seen in a condition called posterior urethral valves in boys, where there's an obstruction to passing urine. Or if the child voids very infrequently, or if the child voids very often. All these are problems. Or if the child sort of leaks urine uncontrollably, what we call as dribbling. Any swelling in the groin area that they see, I think they have to see go to the nearby hospital at any time of the day or night and see. Children who complain, especially boys who complain of severe pain in the genitalia, torsion of the testis. Whenever a child complains of this sort of a pain, I don't think you should take it simply. Any pain that the child complains of, night or day, you have to go to the hospital immediately. No question of delaying it. Usually when the testis twists like in a torsion, the median time that we have to intervene and save the testis is about 3 hours, maximally about 6 hours.
Bedwetting is also another issue. What is your take on it?
Okay, so bedwetting is there are again 2 or 3 angles to this. Technically, children are allowed to wet their bed till toilet training. But generally, in the West, it's about 5 to 7 years. In India, everything happens very fast, so we expect our children to be absolutely all right by the time they go to school, which I think is putting a lot of, unhealthy pressure on that child. What we advise all of them to do is, number one, your stooling habits. Before you go to school in the morning, you should have passed stool. The second aspect is after you have your dinner, for at least 2 hours, I think you shouldn't have any liquids at all. So the problem is not the bedwetting. The problem is the soundness of their sleep. Reduce the amount of cocoa that you take, chocolates, eating chocolates before going to bed. And beyond some ages, for instance, beyond 9 years, 10 years, when they have when they want to go and live with, or stay with their friends or go on trips outside and stuff like that, that time bedwetting becomes a nuisance when you can't really send them somewhere. Or if it is so severe that you have to wear a diaper at night. Those are all the signs that you have to seek advice. I would say somewhere, let us say beyond 7 years, If they're wetting their bed consistently, and then you need to seek attention. Have a diary. It's called bladder diary. You give it to the child, and you say every day in the morning when you wake up, if you find the bed wet, please mention it. Then the next week we add one more thing to it. We say, tell us when did you have water? After dinner, how many times did you have water? So slowly you bring the responsibility of the bedwetting to the child's hands, and surprisingly they do well. Commonest is where the kidney shows, the term we use is dilatation. 7 out of 10 of this sort of water retention in the kidneys disappears on its own or is of no consequence. It's only 3 out of 10, which subsequently goes on to requiring surgery. In some conditions, what we do is as soon as they are born, in a condition called posterior urethral valves in male babies, as soon as they are born, then we sort of shift them to our center. And then within 2 to 3 days, we do an endoscopy and get rid of the obstruction. Some very severe cases, very precious pregnancies, multiple miscarriages, I want this baby somehow, and you find there is a block. Then you can do antenatal intervention. So you can intervene even when the baby is inside the womb.
Robotic surgery is very common in India now among adults. How about children?
Okay, if I can give you a little bit of history, it was in 2011 that Apollo first got its robo. This was a company called Da Vinci. And we have an annual performance review in our hospital where we all have to justify our why we exist. And so at that particular time, our director of medical services said, we have a machine called the robo. And she asked me, can you look into whether it can be used in children? And there was nowhere in India where people were actually doing it. And I found out that you had to go to the US for training. So I went to Stanford.
Okay.
First, spent about 2 weeks there and then went to Chicago with a person called Mohan Gundetti, who by that time had built up a reputation in pediatric robotic surgery. So I spent about 2 weeks with him. And so this was quite an intensive period of time, working for almost 10 to 12 hours a day, understanding how the robo was used. Then we came back and started robotic surgery, and the first child we did was a child from Uganda. She had undergone a road traffic accident and she had lost her urethra. The tube from the bladder to the outside had been crushed. So the first step what we did was we created a urethra from the bladder so she could pass urine. She came back a year later with urine going back up. Now we had a problem. We couldn't approach the bladder from the front by open surgery because the whole thing was very scarred. So we necessarily had to use the robo. So that was the first robotic surgery that we did. This was in 2012.
Here in Chennai?
In Chennai, yeah. We did. And from there till today, we have done about 400 procedures in pediatric urology of all ages. So we do from the smallest baby we have done is 50 days old and 3.5 kgs. We've gone up to 18 years. 18 years is the cutoff. Beyond 18 years, we transition to adults. So it's now the camera is a dual camera which gives you a 3-dimensional vision. Then it gives you a 10 times magnification. And then it gives you depth. Now, in the robotic console, you put your head inside the designated area. And after that, you're cut off from the outside world. You don't know what is happening outside. You are having what the robotic manufacturers called an immersive 3-dimensional vision, and it is breathtaking. These are all very small cuts. They're about 8 millimeters, through which we put specialized instruments. But these instruments are the ones that make the difference. When compared to laparoscopic surgery, robotic instruments have an advantage in that they act exactly like the human wrist. So they can bend and turn and also twist, which means they have more, ability to move or versatility. Robotic surgery in terms of its recovery, early feeding, less pain, delivers on that promise. By evening 2 or 3, they can have actually a solid meal, which happens in robotic surgery, but not in open. And by the next day, the child can actually go home. Very obese children today, and the penis looks very small. That's because there is so much fat around the genitalia that the penis actually becomes buried. This is a known condition called a buried penis. The parents have to follow a healthy lifestyle. Don't keep snacks at home. Don't keep energy drinks at home. Don't allow unnecessary snacking. Don't allow snacking between meals. Once you bring these rules, you're not being harsh on the child. Once you do this, automatically the child will fall into line. I would say the most important thing is to ensure that they stool in the morning before they go to school. Throughout the day, drinking water. This is something that can be very deleterious to the kidney in the long term. Attend to his bodily needs first before he plays on that. Once you do that, you find the child will be healthy.
Bedwetting after the age of 5 is always due to laziness or bad habits. As a pediatric urologist, what is your take?
Not necessarily. If at all, if they can reduce the amount of fluids they have after 6 p.m. in the evening, most of them will find that the bedwetting becomes less. Bedwetting is because of difficulty in arousal from sleep rather than any laziness on the part of the child.
So Google also says that children will outgrow all urinary problems on their own. Like there are suggestions that people keep, putting in on the internet. As a pediatric urologist, like what is your opinion on all these kind of home remedies that are dished out through internet?
This is a tragedy because if you expect everything to be outgrown over a period of time, it's the greatest, misinformation that exists. You should seek medical advice if you have an issue and leave it to your medical practitioner to advise you. You need not take their advice at face value. Once you get your opinion, you were mentioning about, people looking online. You can use ChatGPT, for instance, to find out, this is my condition, this is the doctor's advice. What do you think I should do? You will get a more nuanced answer rather than just listening to somebody saying, this is the way it should be, and they may have no idea what they're talking about.
So what happens generally is people go search. So frequent urinary tract infections among children are very normal. You need not worry about it. As a pediatric urologist, do you agree with this?
Not at all. Frequent urinary tract infections can lead to severe renal damage and renal scarring. We are seeing this time and again. Your renal reserve is reduced. And once you get a renal scar or a damage to the kidney, that cannot be reversed. So this is something, if there are frequent urinary tract infections, you should find out if there is some underlying abnormality causing it.
So there are multiple doctors on internet who say circumcision prevents all urinary and genital problems. Is that true? As a pediatric urologist, do you agree with this statement?
To some extent, it is true. I'll put it in reverse. For a child who gets recurrent urinary tract infections, the scientific way of looking at it is to find out what sort of infections they are getting. So there are multiple bugs that can cause urinary infections. Usually, a growth of more than 1 lakh is considered to be a significant one. Let us say today you get X, tomorrow you get Y, then you get Z, then you know that it is coming from the inside of the foreskin. Then circumcision is helpful. On the contrary, just saying, just circumcise everybody and they will not have urinary infections is wrong.
One more myth that is very common. A child with a swollen testicle or a groin lump can be observed for a few days. You don't need to consult a doctor. You can just wait. You can just observe. Things will be all right. Is that true? As a pediatric urologist, do you see this happening, or do you agree with whatever is being said?
I would never advise anybody to take the risk because primarily what you don't know is what exactly that condition is about. I'll tell you one of the dangers of taking this sort of laid back approach. Suppose you have a groin hernia. Let us say there is bowel coming out, which comes out, the child cries and then relaxes and the bowel goes inside. Sometimes the bowel comes out, especially in a child who's less than 5 years, and it doesn't go back. What it does is two things happen. One is the bowel gets constricted and loses its blood supply and then needs surgery. At the same time, it presses on the blood supply to the testis and destroys the testis also. Now, if you were to ignore this consistently, 5 out of 10 are going to land up with a problem like this. The problem with the groin swelling is you don't know what it is. Is it the testis itself that is going up? Is it intestine coming out? Is something else coming out? How do you know what it is? Unless you go and ask somebody. After you consult somebody and you get their opinion, then by all means go on the net or seek a second opinion and find out whether what the first man or woman said is correct or not. That is the sensible way of doing it.
So ignoring is something that is very common. When these things occur, people tend to ignore. People tend to say that, okay, let's observe for a few days and then we'll take. People also have this belief that my kids are too young to develop any kind of kidney issues or urological issues. Is that true? Do you agree with such understanding?
Not at all. I mean, if such a belief exists, then it should be nipped in the bud. There's a very simple reason for that. Let me tell you this. When you're born, we are born with 2 kidneys, which is the renal reserve you have for the rest of your life. If you preserve these 2 kidneys, you can live up to 90, 95, 100, whatever it is. If you ignore urinary tract infections, what happens is parts of the kidney get destroyed, which means you are actually reducing your lifespan if you do this. So don't ignore these things. Don't think that the child is too small and it will not have any impact on the future. It will have an impact on the future, without a doubt.
So many may also believe that, holding urine for long hours, when it comes to children, when it comes to youngsters, it's very common, it's harmless, it can be allowed. As a pediatric urologist, what is your take on that?
I see this as a tragedy in practice every day. I'm not saying that a child, I've had teachers argue with me, saying that, what do we do, if the child constantly interrupts the class saying, I want to go, what do I do? The answer is somewhere in between. I think every 2 to 3 hours, a child should empty the bladder. Today, what happens is the grip of social media, the grip of the internet is so much that children actively suppress the need to void or to stool, and that can have a very, very bad effect on the kidneys and the overall health of the child.
There is also a discussion that's going online, like when you stumble upon when you surf, when you're surfing in the internet, that boys with undescended testes can wait until adolescence for treatment. Is that true?
That's completely wrong. I'll tell you what happens. The testes are there's a definite reason as to why the testes are hanging in sacs outside the body. They are 2 degrees centigrade less than the body temperature. In a child, there is no sperm, but the precursors of the sperms are there. Okay. So these precursors of the sperms are there. They are waiting for the right stimulus from the brain in order to develop into sperms. Now let us say you consider this like one housing colony. You consider the testis to be like a housing colony in which there are myriads of rooms in which all these primitive cells are just sitting waiting for the right stimulus to come. Let us say you put them in an environment where the temperature is more. Let us say they are inside the tummy. What happens is the colony becomes less and less and less and less. Finally, in adolescence, when you bring it down, the testis might look all right, but inside it will not contain any, there will not be any occupants. So practically all the primitive sperms would have completely gone away. This is a fact. This is well proved. I don't think you can wait.
This is serious. This thought process cannot be allowed.
Cannot be allowed at all. It has to be brought down. Today, I would say approximately within 1 year of age, the testis has to be brought down. In the West, people bring it down even within 6 months. But within 1 year, I think the testis has to be fixed in the scrotum so it remains in an optimal position and it enables that, the precursor of the sperms to be enough numbers to be maintained in a healthy condition.
Doctor, you also spoke about, the threat of child developing fertility issues later. As parents, we are not concerned or we won't think about it like when the child is at 5 years old or like even 10. So I think, is this something that the parents should be actually concerned about?
Absolutely. I'm just tying it with all the discussions that we had before. Fertility is something that it is the duty of the parents to preserve the gonads in a pristine position till puberty, when it gets a kick from the from the pituitary gland. The hormonal cascade comes and then the hormones start producing and the primitive sort of the gonadal cells mature and become either sperm or ova. Which means you asked me a question about, testes not being in the right position. So if they are in an abnormal position, then you have to fix it. That is the gonadal preservation that you're doing as far as the child is concerned. You can't say, no, I will wait for the child to become an adult before I address it. So suppose you say also that you find that, one testis is a little smaller than the other, or it's not going properly. Today we have endocrinology is a wonderful specialty where people actually intervene, do lots of things. It also takes another aspect. Let us say, some children have malignancy also, suppose in the pelvis or something else, and for which various treatment is required. Then, especially if it's a female child, you can do ovarian preservation. You can take the ovaries out of the way of harmful radiation and preserve their fertility. All this has to be done actively. It is true that we are having a sort of an infertility crisis that is coming up now, for which there are multifarious reasons. I am not the expert to talk on that. But from a child's point of view, If we pay attention to gonadal position, gonadal health, and make sure that we get the right medical opinion, rather than rely on something that we have seen or heard, I think we are doing the best as far as the child is concerned.
Actually, doctor, one of the online myths is that my child is sweating, he's playing, and that is enough. Even if he doesn't pass urine, it's fine. Like, he's already sweating and the liquid is out. There is this, common misconception. As a pediatric urologist, what is your take on this?
What we do is whenever somebody comes with a urinary complaint, we look at what is called a urine routine, in which, you can go back and look at your own reports also. There is something called specific gravity. That will tell you how concentrated the urine is. So actually what happens is the ability of the kidney to concentrate urine, a healthy kidney, is very good. If the urine is consistently very concentrated, that means there is not enough fluid intake, especially in a child who is sweating a lot. I think the fluid intake has to be commensurate with the amount of exercise and with the amount of sweating that you do. So the child should void adequately. Just because the child is sweating doesn't mean he doesn't need to go to the toilet. The answer is, if he's sweating and he doesn't have the desire to go to the toilet at all, that means he's not taking enough, which again is a very bad thing. So what we do is we consistently tell people, you have to take enough amount of water. A lot of people ask us, how much water should you take? And we give them approximate sort of age-based estimates on how much water that you should take. Somebody like who is say about 10 years, about 10 kgs or so. It's you take approximately about half a liter of water in a day. I'm just saying. If it's 20 kgs, you take anywhere up to 1 liter. More than that, you go up to 1.8 to 2. But that doesn't mean you must be focused so much on water intake that you're constantly going to the toilet. It has to be a healthy balance between the two.
Thank you, doctor. Thanks for joining us and sharing all your insights. Thank you so much.
Thank you.